Hi everyone. As you all know, by now, primary care burnout is not just bad, it's getting worse. And if you're feeling it, you're not weak, you're not inefficient, and you're definitely not alone. Hi, this is Dr. Gani, a primary care physician of 20 years of experience based in Boston. I have worked in high-pressure environments. I have seen the evolution of primary care. And I can tell you, what we're experiencing now is different. So what is actually happening? But before I continue, I wanted to mention that if you're a primary care clinician who wants to increase income without increasing clinical hours, I have created a program that walks through the full system. You can find the details in the link below. Now let's continue with our conversation. Why burnout is getting worse? First, productivity pressure. More patients, shorter visits, more documentation, more inbox messaging, more metrics. You're expected to be fast, thorough, compassionate, compliant, efficient, and profitable all at the same time. Second, the inbox never closes. Patient messages at night, labs pile up, refill requests stack, prior authorization multiply, and somehow this invisible work doesn't count towards productivity. Third, emotional load. Primary care is no longer just hypertension and diabetes. It's anxiety, it's trauma, it's loneliness, it's social crisis, it's insurance barriers. You're carrying people's life in 15-minute blocks. And here's the dangerous part. Most physicians think burnout is a personal failure. It's me, I'm too slow, I'm not efficient enough. Other doctors handle it better. But no, burnout is often a system mismatch, not a character flaw. So what is actually happening? What will help? Not just yoga, not just self-care Sundays, not just taking a vacation and coming back to 300 messages. What actually helps is a strategic control. Let me break that down. Number one, redesigning your visit flow. Many of us were never taught how to structure visit strategically. We react, we run behind, we overdocument, we underbill. When you learn how to control the flow of a visit, how to guide it, focus it, close it, everything shifts. You finish on time, patients feel heard, you bill appropriately, you stop staying 2 hours late. That alone reduces burnout dramatically. Number two, capturing the work you're already doing. Because most primary care physicians undercode, not because they're dishonest, but because they're cautious, rushed, or unsure. If you're managing multiple chronic conditions, reviewing data, adjusting medications, counseling, that has value. When your documentation reflects the true complexity of your work, your revenue improves. And here's the truth, no one says it out loud. Financial stress fuels burnout. When you feel overworked and underpaid, resentment grows. When you're appropriately compensated, you regain a sense of control. Number three, creating patients' loyalty instead of patients' chaos. Burnout increases when your schedules feel unpredictable and draining. But when patients trust you, really trust you, visits become smoother. When you build deeper relationships, patients come prepared. They follow plans, respect boundaries, stay loyal to you. Your panel becomes an asset, not a burden. Communication is not extra, it's protective. Number four, boundaries that protect you. You cannot answer messages 24/7. You cannot solve every social crisis. You cannot refill every medication instantly. Boundaries are not selfish, they're sustainable medicine. The most fulfilled physicians that I know are not the ones who sacrifice endlessly. They are the ones who practice strategically. Final thought. Burnout is getting worse because expectations are rising, but strategy hasn't evolved. Primary care doesn't have to mean exhaustion. It can mean working fewer days, earning more per visit, feeling valued, living on time, loving your panel. The solution is not quitting medicine, it's practicing it differently. And when you learn how to align efficiency, communication, and revenue, you don't just survive primary care, you thrive in it. If this resonates with you, share it with another primary care provider who needs to hear this. And remember, you're not the problem, the strategy is.